Today we're going to talk about how to get a thick head of hair with hair transplants. And one of the biggest things that's still confusing to me, even after being in the hair transplant world and having 3 hair transplants myself, is the whole idea of grafts and how much hair you can put using grafts in a square centimeter. And also, it's very confusing, I feel like, if I was you, and because I have been you, on the internet, seeing tons of videos of guys showing their hair transplants, and they'll go, oh, I had 3,000 grafts, here's my before and after, and you see this huge, massive difference, or whatever that amount of grafts is, and you go, okay, well, I guess that surgeon's really good, or I guess that's all the grafts that I need because I'm that same guy. And a lot of the things that will come up that that person might not be telling you, and it doesn't mean that they're a dishonest person, they just didn't mention in their video. That person that you saw that result could have been doing laser, they could have started Propecia around the same time that they took that before picture, and now this is the after, and a lot of that growth didn't even have to do with the hair transplant that they had. So there are a lot of other factors that could influence that final result. It doesn't always have to do necessarily with just that number of grafts that they mentioned on the screen or the type of hair transplant that they had done. So that result isn't entirely based off of one factor being how many grafts did they have moved. It is also based on all of those other possibly existing factors. It doesn't always have to do with the type of hair transplant that they did, whether, oh, well, this person did FUE and it was this many grafts, or this person did FUT and it was this many grafts. There's so many other factors. So we've got Dr. McGrath here today to kind of explain some of these factors and some of the things that you might want to look out for and questions that you might want to ask when it comes to, okay, how can I fit as much hair as possible into this square centimeter?
So the question is being posed, how can we achieve the greatest amount of density in a square centimeter with transplant or with transplant alone? As David said, there's a lot of factors involved, whether or not the patient was on finasteride, whether they retained a lot of the existing hair. What I'm going to try to explain in a succinct way is the difference between moving volumes of hair and moving volumes of grafts, because they're 2 different things. You go to a standard hair transplant surgeon, they're going to tell you, okay, we're going to do 1,500 grafts, and we're going to put it all in this frontal zone, and they'll sketch it out for you. And that's fine, and there's nothing wrong with that. But I think it's very important to understand that those 1,500 grafts may only represent 2,500 hairs, because a lot of it has to do with how those grafts are being dissected, how many hairs are in each graft. And that's why when we speak to our patients, we try to get them to understand we're talking about how much hair are we moving. So if I have 6,000 hairs and I'm going to move it into a particular zone, I'm going to use various size grafts. Consider, if you will, for a moment, taking, let's say, for example, in a square centimeter, 35 recipient incisions, which is a safe, normal number of recipient incisions, even maybe 40. But every recipient incision is only going to house, say, a 2-hair graft, maybe a few 3-hair grafts. Well, if you figure it out, you realize you're only getting maybe 90 hairs. Many times what I'm trying to do, when it's possible, it's not always possible with every patient, but when we see these amazing results, I can customize the size of the graft. And many times in even a square centimeter where there's less recipient incisions, say 30 recipient incisions, I might be moving lots of 3- and 4-hair grafts. Well, the math is easy. You've got well over 100 hairs, maybe 110, 120 hairs per square centimeter versus, say, 90. And we know that the more hair you move, the thicker the results are going to be. So what I try to get people to understand is the difference between just getting grafts versus how much hair is being moved. That's a very important question, and I think it's a question that the surgeon should be able to answer very easily, because we know for a fact what the average amount of density is when we remove a donor strip. The average density is 200 hairs per square centimeter. Well, it's easy to be able to discern, did I get 4,000 hairs, 5,000 hairs, 6,000 hairs, and then how the surgeon decides to distribute that hair. That's going to be a big part of what leads to ultimate density. But also, like David is saying, you've also got adjuvant therapy with finasteride, Propecia. You've got laser. You've got all these other factors that can also help to improve the existing hair, so that after this first transplant, you get a patient that gets this amazing result, and then the patient that's looking at it on the video thinks, wow, all of that is a result of just one transplant. That's amazing. And that's not always the case. Our job is to educate you. David has taken up the mantle, and I like to help him, whether it be for our practice or for any other practice, making sure the patients understand there can be many factors that are involved in achieving density, and that's just one of them.
I get tons of comments on my YouTube videos about hair transplants where people will ask, how many grafts did you have moved in that session or this session? And I actually don't know, and the reason I don't know is that I didn't pay by the graft. So I paid by the amount of hairs. And this is really important, because if you ask me, for instance, how many grafts did you have in that session? Well, I could say I had 1,000 grafts, and that only might be 1,000 hairs if they were all 1 hair grafts. Or I could say I had 1,000 grafts, but they were all 3 hair grafts. That's 3,000 hairs. That's a huge difference. Or in my case, a lot of the reasons I achieved such good density is I had multiple follicular units. They're called MFU. So a multiple follicular unit is actually where it's a piece of skin, basically, that has multiple follicular units. So actually it might have multiple, 2, 3, even 4 hair grafts inside of one unit that's now slipped under the skin. So in one unit that you've been put in your hair, you suddenly have 8 hairs, potentially. So I might say, okay, I had 1,000 multiple follicular units moved. That could be 8,000 hairs. So now if you understand that, you start to realize that looking at that, oh, how many grafts did you have done, is kind of a very confusing thought. And it's also quite frustrating, I think, as a buyer, when you're paying by the graft. If your hair is a pizza, well, I'm going to sell one piece of pizza and it's $2. And you'd go, okay, well, I guess that's kind of reasonable, but I chopped the pizza up to the point that it's 10 slices. So now you've got only 1/10 of a pizza pie for $2. But on the other hand, I could have sold you one piece of pizza for $2 that was 1/4 of the pizza pie. Well, obviously, this is a completely different type of transaction, but yet if we were just going by the piece of pizza or the graft, then you kind of don't know how much hair really you're having moved, and this could lead to a completely different result, lead to you being full or you still wanting to go back and eat more pizza.